Welcome back to the Sleep Edit. I'm Dr. Craig Canapari.
And I'm Arielle Greenleaf.
So this week we have a mailbag episode of questions. So I thought we'd just get into it. We have a lot of good questions. Our first segment is on infant sleep patterns and challenges. Here, I'll say the first one. Lauren asks, when do babies start dreaming?
Well, it's a really good question. And I was going to ask you that one.
REM sleep, which is what we think of as the predominant stage of sleep that happens with dreaming, actually is the most prominent phase of sleep from birth. So as far as we can tell, babies are actually dreaming even in the womb, though it would be very difficult to verify that for sure. But they are, even if they are born early, at the time of birth, having active sleep, which is the equivalent of REM sleep. It happens usually in the last trimester of pregnancy on. So cool.
Yeah.
Otherwise, they're probably getting pretty bored until someone figures out how to insert a tiny iPhone into the womb.
I guess, and some of the questions I get, when do they start having bad dreams? Infants aren't dealing with fears the way we think of fears. So bad dreams, nightmares don't occur until later in toddlerhood when the imaginary comes to life.
Yeah, you need a certain amount of abstraction for nighttime fears. It's usually, I'd say, really concrete ones, or ages 4 or 5, sometimes in earlier ones, like worrying about someone breaking into the house. Hey, let me read this next one, Arno, because I think this might be a good one for you. Susan, who is a pediatric sleep fellow and mom of a 5-month-old, God bless. Pray. I have a question about why babies wake. My little one naps between 45 minutes to 1.5 hours and sleeps 4 to 5 hour stretches at night, starting at 7:30 p.m. Sometimes I think he wakes to feed. Other times I feel like he wakes between sleep cycles and needs help getting back to sleep. Do you have any tips for differentiating between waking to feed and just needing more sleep? I'd say maybe needing soothing to go back to sleep.
Sure. The place I would start is talk to your pediatrician about night feeds. Is your baby gaining weight? How much are they getting during the day? It's really important to look at that because sometimes parents don't realize that their baby's not getting enough. Especially I've seen that when someone is transitioning from breastfeeding to formula. It's not a one-to-one conversion. And so babies need more formula in order to stay full. So I've seen it where parents just don't know that they're not feeding their baby enough. So I think that is a really tricky question because it's very unique to the individual. As far as, if your pediatrician says that they feel like your child could sleep through the night, or they feel that your child could have one night feeding, then you want to really have the first stretch of sleep to be like the most uninterrupted portion of the night if possible. So I generally use 11 p.m. or 12 a.m. as like a cutoff for feeding, especially if the child was fed right at bedtime. By 5 or 6 months, that they should be able to go 4, 5, 6 hours before needing another feeding at that first stretch of the night. However, again, we have to look at what does daytime feeding look like. It's really important.
I would add the extra layer of this mom probably had 3 or 4 months off for maternity leave, now back to work, maybe nursing, maybe formula, maybe doing a little bit of both. It certainly can be a challenging time for moms when they return to work as well, to try to balance quality time with the baby and getting enough sleep. I think it's always the answers to questions like this have to be very specific, but I think looking at feeding is a good idea.
I also think it's important to recognize how you're putting your baby to sleep at the start of the night. So if your baby can go to sleep at the start of the night independently, then they should be able, if they're not hungry or they're not sick, they should be able to put themselves back to sleep in the middle of the night as well. And sometimes you have to give them a little nudge and remind them that they can do it themselves and choose sort of a sleep training method at the start of the night or throughout the night, regardless of, wherever you are in that sleep training journey. But if your child is falling asleep independently and waking throughout the night, you should be looking at whether are you continuing that sleep training throughout the night.
Yeah, you're definitely getting in the window where you could think about trying to work towards independent sleep at bedtime.
Andrea asks, how can I sleep train at night when my 11-month-old barely sleeps at nursery during the day? The first days or weeks of sleep training mean no restful sleep during the day or night, and it's overwhelming.
Yeah, I'm not sure I quite understand this.
I do.
Okay.
Yeah, I think what she's saying is she's very concerned because her child doesn't sleep well at nursery, daycare, and then she's concerned about sleep training at night because she's concerned that the child won't get any sleep if she's sleep training, and it sounds like she's concerned that the child is going to be losing tons of sleep while sleep training overnight and then not sleeping during the day at nursery. So how do you handle that? And I guess what I would say is it really doesn't take well, your child should not be awake overnight for days and weeks if you're sleep training. That's not really and I've never seen that as an issue where it's like such long amount
Sure.
of time that that the child is so crazy tired. So I would say just go for it. If they're tired during the day, maybe back up bedtime a little bit if they're extra tired and not sleeping at all. But I would go for it, especially if they're not sleeping during the day. Let's get them to sleep overnight.
Yeah, no, I would agree with that. Okay. So here's another one. Chelsea, our 6.5-month-old has been sleep trained, Ferber, for about a month and sleeps from 7 p.m. to 5 a.m. I would celebrate that win, first of all, Chelsea. But how do we avoid these early morning awakenings? Should we just accept that he's a 10-hour overnight sleeper?
You want me to tackle that or you want that?
I'd say that a lot of this depends on how much he's napping during the day. I'd say that 5 a.m. is in the low end of normal, the early end of normal for a young child, and it is painful. What do you think?
Well, I think one of the biggest things that I do is look at overall sleep. So, like you said, let's look at naps. How much sleep does this child need in a 24-hour period? Because it's possible that they're maxing out. And so a 7 p.m. bedtime yields a 5 a.m. wake up, but perhaps an 8 p.m. bedtime would not. However, it could also be if you start capping naps and try to shift some of that overall sleep into the nighttime, you could perhaps get rid of that 5 a.m. waking. But it really depends on the child because some babies just really love waking up early, just like some adults. So for me, it's a matter of, again, it is looking at that daytime sleep and the timing of everything. And I also like to look at the fact, like, I always ask the question, have they always woken at 5 a.m. or is this something new? Because if they've always woken at 5 a.m., it's more likely that they're just early birds. But if it's something new, it's probably something that you can shift around a little bit with scheduling. But I would say early wake ups are probably one of the hardest things to solve.
Yeah, absolutely. Yeah, and the basic stuff, make sure the room's dark. Though if you're in the northern hemisphere, it probably is dark at 5 in the morning currently. Make sure there's is there trash pickup going on when this child wakes up at 5 in the morning? Something like a sound machine could be helpful. It's tough though. It's a tough problem. You want to read the next one?
Sure. Okay, Caitlin asks, I have a 7-month-old who has just started sleeping better. This will be our first daylight savings time, and I'm terrified. How can I preserve the progress we've made with his sleep?
I can speak to this. Yeah, the falling back is the tough one for parents of young kids who are getting up early, because if your kid was getting up at 6 in the morning, guess what? I think it's November 4th this year, all of a sudden that's 5 in the morning. And it'll feel like 6 in the morning because you won't have adjusted to the new schedule, but the rest of your life probably will not. So often I just tell parents, just keep your kid on the clock schedule. You can maybe move them 30 minutes later for bedtime for a few nights before, but most kids really don't need a huge adjustment here. It's not going to For a 7-month-old, it's not typically going to result in a lot of middle of the night awakenings. I think it's just your baby's going to have to shift their sleep schedule an hour later just to be in sync with everything else. So I don't think that's a huge lift, though.
No, I agree. And I think some babies are just sensitive to any change. It just is who they are. But I generally prefer not to do any sort of shifting of schedules unless a parent is really, really nervous about it and it makes them feel better to do that. In which case, I'll say push wake up time, nap time, bedtime about 10 to 15 minutes later for, 7 days leading up to the time change. And then the goal is you're putting the baby to bed an hour later for everything so that when you wake up on Sunday, the baby's already on schedule. But shifting a baby's schedule by that much can be really challenging and may backfire in a way that even just following the clock, like you said, wouldn't backfire. The other thing is that I just say if, for a few days, you may have to put baby to bed actually a little bit later. Isn't it later? 30 minutes or
Well, it'll
so? Because
be
they need more sleep drive or
the
am I getting my...
here. It's like jet lag.
Yeah, yeah.
The clock's going to shift and the baby's natural biology is not going to change. So the schedule is actually, since we're falling back, the clock time is ratcheting earlier. So if the child was sleeping from 7 to 5, like the previous example, all of a sudden the child's sleep schedule is going to be 6 to 4.
Right.
If you don't make any changes.
Right.
Right. So for teenagers, it's great because all of a sudden school feels like it's starting an hour later. But for kids who are waking their parents up, falling back is more difficult. But I wouldn't overcomplicate it unless your child has special needs. I think if you're going to do anything, try to shift the afternoon nap and the bedtime a little bit later. But it's your first rodeo. I would maybe just go with the clock time and recognize your baby's going to be a little bit irritable that first night. Maybe the first night after the shift, your child stays up 30 minutes. You keep them up 30 minutes later and then they get used to it. But just try to stick with the clock schedule, which is going to feel later to the baby. Let me just make this simple, okay? Because it is a really confusing topic. If you want to prepare in advance, you could have your baby stay up 15 to 20 minutes later for a night or two. Otherwise, I would just try to stick to the clock schedule. So on the Sunday after the daylight savings time shift, you could just try to keep your baby up to the clock time, which will be an hour later. If you don't make it, that's okay. So if your kid's usual sleep time was 7:30 and they're irritable at 7 because 7 feels like 8 p.m. used to, that's okay. You can put them to bed. They're going to adjust pretty quickly.
Yeah. Yeah. I think it's just get them outside in the sun and know that it'll take a couple days, but it should be fine.
Okay. Kaylee asks, my 9-month-old wakes in the middle of the night, babbles for a while, and then cries. I end up going in to resettle him, which gives me more sleep than waiting for him to cry it out. How do I break this cycle?
Oh boy. It comes back to how do you even know that the baby is babbling and moving around in their crib and not crying? This is a big problem I'm finding with a lot of clients, right? In that, there's some really great technology out there and it gives us lots of information. But if we didn't have those smart monitors, we'd have no idea that baby was awake and babbling and moving around. As far as the crying goes, it's 9-month-old, is that right?
Yeah.
No, I mean, generally speaking, 9-month-olds can sleep through the night. But again, I think you have to go back and look at how are they falling asleep in the middle of the night? Are they getting the right number of feeds? Could they be hungry? Speak to the doctor about that. If the child is healthy and they're getting all the nutrients that they need throughout the day, then the best bet is to choose a method and stick with it. Start with bedtime. You have to start with bedtime and then follow throughout the night. But I think it's important to remember, I understand the idea of, maximizing sleep. I think a lot of people, and some of the questions we've heard already, assume that sleep training is going to take like days and weeks of prolonged crying and sleepless nights, and it's just really not that bad. And in the majority of cases, parents are like, "Why did I wait so long and why was I so nervous?"
Yeah, I think in this case, baby needs to be falling asleep independently at bedtime. If that is not the case, do not stop go. Just do some sort of sleep training technique at bedtime to have the child fall asleep independently. And Ariel, I think you texted me that you wished everyone would throw their Nanit out the window.
I
Are
sure
you referring to
did.
sponsor of the show,
Oh
Nanit?
gosh, I feel
I'm just
bad.
if you want to sponsor
Yeah.
us or sponsor me, not Ariel.
Well,
No, but I think I think that it does sound like in this example the baby is crying, but I do think that and sometimes you inadvertently power this habit because you're anticipating crying. So when you hear the baby babble, you go in, put in the pacifier, pat them. So then when they have a natural awakening, they're going to cry because that's what they're used to. So again, if your baby's falling asleep independently at bedtime, you may need to ignore them and let them cry a little bit. If they're not falling asleep independently at bedtime, that's what I would do.
Craig, I didn't put these in our questions, but I got two different sleep coaches asked to discuss how it's normal for babies to wake throughout the night, and that sometimes they're just kicking around and they're playing with their fingers or their feet, like this baby. And I've noticed that people are so concerned about these awakenings. And sometimes the baby's awake for, an hour, but they're so concerned in the morning and they see it as their baby didn't sleep through the night, even if they're not signaling. They're not crying out, they're not hysterical, they're just awake. So, what are your thoughts on that?
I think it's perfectly natural for people to awaken during the night. And it's true of babies, it's true of grown-ups. And if your child doesn't seem to need anything, you don't need to worry about it. If the monitor says they're having broken sleep at night and you don't hear from them in the middle of the night, it's not cause for concern to me. I think that as babies go through the night, they go through non-REM sleep, then they go through REM sleep, and then they wake up and they go back to sleep, and it's totally natural. So just take pleasure in watching your baby practice rolling or putting their fingers in their mouth or babbling to themselves. This is just normal development. And I think it's a wonderful thing if a child can entertain themselves in their crib or their bassinet and actually not have you present for that.
Absolutely. I mean, I think that's one of the goals we have when we are helping parents through these sleep challenges. We want the babies to feel comfortable and have it be a safe space for them to. I agree.
Okay, we are on section 2, early morning awakenings and sleep regressions. So we did cover this a little bit, but Leah, we can go rapid fire for these. They're related. Brittany asks, once a child is sleep trained, how should nighttime awakenings be handled to avoid reversing the progress?
Stay consistent. I mean, as long as you know your child is healthy and otherwise well cared for, you can see on the monitor probably whether they vomited or something like that. Then the most important thing is to stay consistent, because one of the biggest things I see with regressions is they can happen out of nowhere, and you can suddenly have these wakings and parents are so confused because baby has been sleeping well and this is out of the ordinary. And so they go in and then the ball of yarn starts to unravel. And 6 weeks later, they're coming to me saying, I don't know what happened. And now we're in a horrible spot. So as long as your baby is healthy and otherwise fine, I would stay consistent with whatever method you chose. If you feel like you need to go in for a quick check, make it quick, brief, don't, no fanfare, and be out of there as quickly as you can.
Agree. And look, sometimes your kid's going to have an ear infection and wake up at night. And that doesn't mean that they're not sleep trained anymore. If they've got a cold or you're traveling and something comes up.
Yeah, I think that's a really important point. I often see parents saying, I've had to sleep train. I sleep trained and I keep having to re-sleep train, and I you're not really re-sleep training. What you're doing is recalibrating. If you go on vacation, your own sleep gets out of whack. You come home, you have to get back into the schedule. You probably have to wake up a little earlier, go to bed a little earlier. And it's the same is true for your baby. So illness, like you said, travel, those things are probably going to affect baby sleep. And I just look at it as getting back into routine.
Agreed. So let's see. I've actually got a couple of let this compare and contrast. So these are 3 early morning awakening questions.
Okay.
Chelsea asked about a 6.5-month-old who's been sleep trained but wakes up at 5 in the morning consistently. How do we troubleshoot early morning awakenings? We talked about that a little bit. In a child this age, again, some of it, you might have to subtract a little bit from the daytime naps if they're excessive, but I think that it is early. Let's read these others as well, because I think it's a little bit of compare and
Okay.
contrast.
Yeah.
Hunter asks, our 2 daughters, ages 6 and nearly 4, wake up extremely early, with the youngest regularly getting up at 4:20 in the morning. We've tried adjusting bedtimes, but nothing seems to help. What strategies do you recommend for handling early risers? 4:20, a cool time to wake up, but not for parents, is pretty early. And Pauline asks, can you suggest strategies for children with ASD who take melatonin to fall asleep, but wake in the early morning and won't return to sleep? We've considered various factors such as pain, consistency, and routine and family response, but nothing has helped. So, Chelsea, I think we talked about a little bit earlier. I have an idea about Hunter, but
Yeah, go ahead with your Hunter, and if I have anything to add.
so sometimes I've had situations like this where we have a 6-year-old and a 4-year-old, or a 6-year-old and a 3-year-old, say, who are sharing a room, and the 4-year-old is napping and the 6-year-old is not. And the result can be sometimes that the 4-year-old is either needs to go to bed later or get up earlier because they're getting more sleep than they need with their sleep opportunity.
Or drop their nap.
So dropping the nap can be helpful. Again, and kind listeners, I always appreciate these, and we don't always include all the details. Sometimes you need a kind of bespoke solution with a schedule, but I'd say that certainly if the 4-year-old is napping, I would definitely get rid of the nap. Adjusting bedtimes sometimes needs to take a little bit longer than a few nights. So a later bedtime, doing it for a night or two is not necessarily going to work. You almost have to generate some sleep debt. And I think also some children just need less sleep than others. If your child is well rested, makes it through the day without napping, you may want to transition to some strategies like an okay to wake clock or like a morning light kind of protocol, which I can link to in the show notes, to say your child can quietly stay in their room and play as long as they don't wake up other people. But the key is making sure they have enough sleep.
Yeah, and I also think though that you need to look at what is happening when they wake up. Or what is your response to them? What do they get to watch a tablet so that you can keep sleeping? Do they get to watch TV? Do they get
Do they get to
something?
cuddle
Do
with
they
mom and
get to
dad?
Yeah, do they go into bed? Because I find that a lot of times at that age, they're waking not because they're not tired, but it's more that there's an anticipation that they get to do something. And then they probably are tired on the other end, because that's really early. That's exceptionally. And so you have to, I would start with what is the response right now? I absolutely would be looking at the schedule for the 4-year-old. But also, what is the response that these children are getting when they wake up that early? And are you getting them up? Are you taking them outside? Are you feeding them breakfast? Looking at all that and then deciding like, what what is the start of the day for you? Because 4 a.m. to me is the middle of the night.
Yeah, it's agony. Hunter, I feel your pain.
Yes,
Definitely
big time.
shoot us an email with follow-up because I'm curious. It is exceptionally early. Pauline's question is, as a child with autism spectrum disorder, waking up in the early morning with melatonin. And I would say that, first of all, I look at the melatonin dose. So typically for kids that are less than 80, around 90 pounds, the recommended dose is 3 milligrams. And for kids that are over that weight, for the European use is the 40 kilogram cutoff. 5 milligrams is the maximum dose. If it is higher than that, sometimes that can cause middle of the night awakenings or nightmares. So certainly sometimes the lower dose can be more effective. They've looked for pain, they've looked at consistency, routine, and how they respond, and nothing has helped. we're going to have Beth Malo on. This is a very common issue in autism spectrum disorder, and it can be quite challenging to address. But similar to the last example, what happens with this child when they get up early in the morning? Tired parents often inadvertently offer reinforcement. And I've seen many parents of autistic children letting them have some screen time. And if that doesn't compromise the functioning of the household and allows the parent to sleep, it may be something that's necessary. Certainly, I have seen a lot of kids have some better luck if they're getting a lot of physical activity during the day, but it often is a lot of physical activity. Like parents will say that they go on vacation and their kids swimming all day at the beach and then they sleep in later. That isn't really practical in October when your kid's going to school for them to exercise for 8 hours. Sometimes looking at the sensory environment, trying something like a Likert sheet or working with occupational therapy can help for sensory issues. And certainly ABA therapy for autism can help sometimes. But these are early morning awakenings, I think, we've alluded to some of the most challenging problems.
Absolutely.
Okay, now co-sleeping and sleep transitions. Ariel, this is a good one for you. Howie asks, my 2-year-old and I have co-slept since birth. How can I transition him to sleep on his own without me needing to sleep in his room?
Yeah.
You're making her feel good with your response.
I'm so sorry. I'm not trying to. No, I think it's. I always hate this because it's like everything. I always say it depends. It depends because every situation is so different. I think a method like camping out can be really helpful. I think you can't just innate your presence in a situation like this because the child is so used to your presence all the time overnight that it just completely removing your parent presence would not be helpful. So I think a method like camping out would be useful. It's going to take time and consistency to get there, but I think that would be my number one option for this, and this is what I've used in the past. I wonder. So you said,
Ariel, why don't you just explain what you mean by camping out?
yeah, sure. So camping out, basically, we start with the parent sitting right next to the bed or the crib. And they are sitting there until the child falls asleep. And that can be really tiring, but it can also be reassuring to the child. The bigger thing that becomes tiring is you have to stay consistent with that throughout the night. So he falls asleep. He sleeps for 3 hours. He wakes up. It's midnight or something like that. You have to go ahead and go back in there and sit until he falls back asleep. There's got to be a lot of reassurance with that because they're alone for the first time ever in a bed. So you've got to follow through with that. I just always tell parents we're going to put our body armor on and we're going to get through it. And you will get there. You just stay consistent. It's hard to know, how far into 2 is this child because there could certainly be some other tools that you could use. I'm just thinking about your puppy. What is it? The Huggy Puppy?
Huggy Bee?
I mean, at 2, that's probably too young, but it depends on, are they closer to 3? Where are they developmentally?
Yeah.
Because sometimes things like that, or like an article of the parent's clothing that smells like them or something like that can be really helpful. But yes, so camping out, essentially the goal is that you're slowly moving yourself away from the bed or the crib over the course of, usually it's more like 2 weeks. And then the ultimate goal is you're out in the hall and the doors, slightly open, ajar, and then eventually you're not having to sit there with them at all.
So yeah, 2's a tough age. My first foray, I might be like, okay, yeah, I think no matter the age you have to sell it, be like, oh my God, you're such a big kid now. You're ready to go in your room, and really do a lot of salesmanship about this. Make it exciting. Have your child spend some time in the room by themselves during the day, maybe start with a nap. And I might just say, okay, I'm going to stay with you for a couple of nights and we're going to have a fun sleepover in your room. And then mommy needs to go back to her room. And then because camping out is labor intensive, I might just see, some kids, this might go fine, right? Like,
Absolutely.
kids
Yeah.
that might be like, oh, okay, this is how it is.
Right.
So be optimistic that it could go smoothly, but if it's more difficult, you might need to be more gradually.
Yeah. I mean,
Right.
like a be right back method where you put the child to bed and you promise to come back. You have to actually go back.
Yeah.
You have to gain their
Yeah.
trust that you're going to go back. But just starting with little steps like that can be helpful. New stuffed animals, things like that can be useful.
So here's another one from Ashley. I co-sleep with my 3-year-old in his room, but I need some more support in my bed and back pain relief. If I leave after he falls asleep, he eventually comes to my room. Any suggestions on how to transition him to sleeping independently?
I'm going to leave that one to you.
I would say that, first of all, Ashley, good for you for prioritizing self-care. And I think what your child needs is to learn to fall asleep independently at bedtime. There's lots of different ways to do it. We mentioned camping out. Taking a break is when you're coming in, you leave the room and you come in and you check and you build that muscle towards independent sleep. But I think working towards independent sleep at bedtime is your point of maximum leverage. The nighttime awakening should improve. I'll leave it at that.
Yeah, I would agree with that because if the child, I mean, the expectation right now is that mom is going to sleep in the room. And of course, if he wakes in the night and mom's not there, that's upsetting. So starting at this, yeah, I totally agree.
I'm also a big fan of saying, this is a 3-year-old. This child can understand, be like, you know what? Mommy's back hurts and I can't sleep in this bed anymore.
Yeah.
And just that is totally legitimate thing to say to your child. They can respond how they like, but you control your own body and you can make a choice not to lay down with your 3-year-old anymore. And I would encourage you to do that because if it's causing you pain, you shouldn't do it.
Yeah. And I would say, I mean, I've done that with my own child. I've had to, um, well, it's not a lie either. When I don't sleep, I literally feel sick. And she went through some crazy regression in the threes, somewhere in the threes. And I literally just said to her, when you do this, mommy doesn't feel good. And I want to feel good so I can have fun with you. And that actually made all the difference. I'm like, why didn't I think of this sooner? Sometimes it's the simple things and you forget how kids learn quickly and they can pick up on things very quickly.
Yeah. I think modeling self-care and expressing what you need. There's been a real thing since attachment parenting it had its heyday in the 90s and the early 2000s of this idea that we have to do everything for our children. They can never be uncomfortable or upset, even at the expense of our own mental or physical health. And I would empower you parents to say it doesn't have to be that way. And it's okay to say to your parents, you know what? That's uncomfortable for me. I'm not doing this. That we're not doing it this way anymore because I can't.
Well, it's really just setting healthy boundaries,
Yeah.
honestly.
Okay, here's another one. Katie asks, my nearly 3-year-old daughter has her own room for the first time after her recent move. First of all, Katie, that's wonderful. And it's a cause for celebration that your new move, hopefully.
Yeah.
She wakes during the night and asks my husband to sleep next to her in her crib. Any advice for breaking the habit? First of all, I would ask, how large is your husband? Can he get into a crib?
Maybe he's not actually in the crib. He's next to the crib.
Maybe he's just got his hand in there. I'm just
Yeah.
imagining like a little tiny man. Katie,
Possibly. I've definitely seen people and heard of people sleeping in
I
the.
was too tall to get in my kid's crib, but I've definitely seen parents do it.
Yes.
I think that I think this is one of those things is just, first of all, just be like, oh my God, it's so exciting. You're in your big girl room. Daddy can stay a little bit next to you here, but he can't really lay down here. It's not comfortable anymore.
I'm a big fan of timers. So daddy will lay next to you for you choose the time. I mean, I prefer shorter amounts of time. You might have to start with a little bit of a longer amount of time and slowly back it up. But again, this is about setting healthy limits, not just for him, but for her, because it ultimately benefits everybody to have everyone sleeping in their own sleep space. So timers can be really helpful, along with I'll come back and check on you, or a bedtime pass might be useful there. calling out after bedtime for one, glass of water or hug or whatever that might be. But basically, you just have to set the boundaries and stick to them. And I know everybody thinks it's going to take forever for them to figure it out, but I promise you, if you're consistent, she should be okay in a few nights.
Yeah. And I would say that any parent that wants to break a habit, you can just decide to stop doing something and your child will adapt. Maybe unpleasant for a night or two. And some people want to do a gentler approach. But again, if something doesn't work for you, it's okay to stop it. Here's one. Kimberly asks, our 3-year-old wakes multiple times during the night screaming for hugs. Such a great description. He will vomit if we let him cry, so we end up waiting for him to fall back asleep, which can take 10 to 30 minutes. What consistent strategy can help us break this cycle without going back into his room? I'd say the vomiting with crying is up there with the dreaded sleep deuce as a move that it's difficult for parents to.
You can't go in and be like, sorry, you pooped in your diaper. I'm not helping you. I mean, that's just not something. And they definitely learn it. It's just working with someone recently, a return client this is the latest thing.
Checkmate.
Yeah.
I mean, there's nothing. It's unstoppable.
Yeah. So I actually said, put her in the pull-up earlier and maybe put her into bed earlier so that she's doing, going to the bathroom earlier and then actually going to sleep time. And that did start to work. So I think the vomiting thing is a little tricky. I know with younger babies and toddlers, generally recommend that they go in, clean them up without much attention and put them back into bed or, continue on with the method. However, I know that would be uncomfortable for some people. What would you say about that?
I think first off, I'd say, make sure your kid gets checked out by your pediatrician, that he doesn't have acid reflux, because certainly some kids that vomit easily could have acid reflux. Again, he probably doesn't. You may have already thought of that. Often there's a lot of anxiety here with kids that do this. I think that if your child, one place that might be a little bit safer is to work on some separation during the day. If separation is also a problem during the day, working with a mental health provider to work on separation anxiety, because this has a real separation anxiety flavor to me. I'm often in this age group a big fan of building that separation muscle, but not quite getting to the point where your child is hysterical, because they can't think, right? Like when your child doesn't enjoy vomiting.
No.
So he's getting so jacked up that he's throwing up. I think he's lost the capacity to reason. And 3-year-olds are only selectively reason, as we know. I think working on seeing if you could incentivize some time with him. Again, work towards independent sleep at bedtime if you are not there. Start gradually scaling back your intervention. I don't know. If he's really struggling all the time with separating during the day, you probably want to work with a professional on separation anxiety, which is very common. If it's just a nighttime thing, I think that really start gradually, work towards independent sleep at bedtime, start scaling back your interventions at bedtime. And as Ariel says, if he gets to the point where he vomits, then I think you do clean him up and put him back to bed, but not really dwell on it too much. But I'd make sure any anxiety component of this is addressed.
Yeah, definitely.
And I think the next one, another Holly is asking about a 3-year-old who co-sleeps and wants to transition to independent sleeping. I think at age 3, that's a great opportunity to get pumped. Be like, oh my God, you're such a big kid. You're totally ready for this. This is amazing. We'll have a couple of sleepovers in your room, and then you are going to be sleeping in a big boy bed by yourself. It's great. And just sell it like that.
Totally agree.
It has to be a big, terrible thing.
Yeah, no, I actually sometimes if I'm dealing with a 3-year-old or a 4-year-old, because some people keep their kids in cribs for as long as possible. But if I'm dealing with a child that age who's still in a crib, I often will transition them to a bed, and it's like new rules because new big kid, So like, I find it can be exciting. You can make it exciting and offer a little bit of reassurance, like Craig said. but I wouldn't linger on with sleeping in their bedroom for long periods of time. And you might even try not even doing that. Maybe you start with sitting next to the bed and saying, "Well, new exciting things. I'll read you a book and then we're going to do this." And then, sometimes guided meditations. You could listen to a guided meditation in the dark, but make it exciting. I would definitely make it exciting.
Yeah, not like at the moment of bedtime, but just sell it. Be like, let's pick out some sheets. This is going to be great. When my kids were little, my older son really liked the Wiggles, which are it's like really over the top, cheesy. Who's the guy on YouTube that all the kids like now?
Well,
Where's the weird
there
beret?
was Blippi.
Blippi, yeah, like Blippi.
Yeah.
It's like when you're trying to sell something to your kid, embarrass yourself a little bit. Like not at bedtime, but be pumped, make it exciting, make them feel good about this transition.
Absolutely.
Okay, here's another section: a question on travel and disruptions in routine. Abby asks, our 10-month-old sleeps well at home but struggles to sleep through the night when we travel. We try to keep the bedtime routine as consistent as possible. Do you have any advice for making sleep during trips easier?
I really wish I had some wonderful advice for this other than, eventually she will start to sleep better while traveling. Try to keep her well rested. You said you're doing the bedtime routine. That's great. Trying to recreate the environment. So if you've got blackout shades and a white noise machine at home, it can help. There's, plenty of disposable blackout shades you can use, or even black trash bags. You know, Anything to sort of recreate the environment. But honestly, travel for children can be difficult. It's not uncommon for travel to be difficult for a baby or a toddler.
They didn't have them when my kids were little, but those sleep pods that they have, it's like a little tent.
Yeah,
That your baby
slumber
sleeps
pod.
in. Yeah, I'm a big fan of those. Actually, I think it's great. It's pitch black. They can't see you, especially if they're after 6 months of age. If you have them sleeping in a different room, something like that can be helpful. But this too shall pass.
Yeah, I
With
know.
your
I wish there was something wonderful, because I went through it myself, and I'd called them trips, not vacations, for quite some
It's not
time.
your vacations are over.
No, that's not
Your child.
true. No, your child will be okay eventually, but it is,
Yeah, it's
some children
frustrating.
are just more sensitive than others, and I was part of that camp, so I feel your
Okay, here's a section on nighttime anxiety and sleep fears. Andrea asks, my 4-year-old never stays asleep in his room and comes to sleep in my room every night. He's scared to sleep alone and also fears being by himself even when awake. How can I help him feel comfortable sleeping alone in his own space?
I think that goes back to what you were saying. It sounds like there's some separation anxiety going on there. If he fears being alone,
I'm going to
even
put in the show notes that Eli Leibovitz book on anxiety, which is very good,
okay.
has a detailed plans on how to deal with separation anxiety. Also on my website, he has something in his book, one of his books called the Yale Plan for Independent Sleep at Bedtime for Kids with Separation Anxiety. I'll link to it. But I'd say the key is basically working for kids that are very anxious. You want to work on independence, but very gradually. If he is struggling with separation or being alone when awake, honestly, working with a behavioral specialist during the day is often the least threatening. Because if your kid can't be alone in his room for 5 minutes during the day, nighttime is a lot scarier. I'd see if you could work with someone on that. Again, it doesn't mean there's anything terribly wrong with your kid. This is incredibly common, but working up and building that muscle of independent sleep.
Or just
Or
independence.
Yeah.
Because that's tricky. It's hard to, like you said, it's hard to do that overnight if they can't feel comfortable during the day.
Okay. Here's one. Stephanie asks, when is it appropriate to go in and help your child fall back asleep? My 2-year-old wakes up and when we go in, it turns into a party. How do we know when it's really necessary to intervene?
Well, at 2, I would say it's probably unnecessary the majority of the time, unless the child has health issues and needs to be fed overnight, but that's very unusual at that age. It
This
sounds
is sometimes where these two-way monitors can be helpful. where you can just say, "Oh, you got to go back to bed. Good night."
Sometimes, but some kids are scared of that. The great and powerful Oz comes out and that freaks them out. I'm serious.
Pay no attention to the man behind the curtain.
I mean, if it's consistent that the child just wants to party, then you've got to work again. We got to look at bedtime. How is bedtime? How are they falling asleep? And that's where we start. I know we sound like broken records when we say
Yeah.
that, but that's where you have to start, and then you have to follow through with that consistency so that they understand the boundary and the way that it works, and that they feel comfortable when they wake up in the middle of the night. They definitely don't need you for a party. They can party by themselves in the crib.
Totally. Leslie asks, my 7-year-old grandson wakes up around 3 to 4 in the morning when he stays overnight with us, even though he wakes up later at home. I think he wakes up early to spend more time here. Any strategies to help him sleep later?
Yeah, don't get up with him if you're. I mean, it sounds like he's being incentivized. So
I would agree. Leslie, first of all, I love a grandparent question. Grandparents are the
Yes.
best. I used to spend a lot of time with my grandmas when I was a kid. I think there may be 2 layers to it. Some of it is just sleeping in an unfamiliar environment, but think about how you may be reinforcing this behavior. I'm sure you really enjoy having him come to visit, but if you're getting up with him, if you're getting him a snack, if you're letting him play with a toy or something like that, I think if he sleeps well at home and this is at your house, I think the expectation needs to be that you don't see him in the morning till his wake time. He's 7 years old. He should be able to do that.
might be helpful
So,
to get an okay to wake clock or something at grandma's house. Something so that it signals to him that it's okay to get up. But I would, if you're getting him up, or, offering a snack or something like that, the way to make it stop is to stop.
honestly, I don't think
Think
a
of
7-year-old
new.
can likely read a clock. I think you
No,
could
but
just
an
give him-
okay to wake, like something visual. They can read a clock. A 7-year-old
You
can
know what
read.
I'm saying? I don't think an okay to wake clock is a clock that changes color based on whether or not the child can get up or not. I don't think you need it for a 7-year-old. Just get a digital clock and be like, okay, if you're awake in the middle of the night, if it's an emergency, you can come get me. Otherwise, I'll see you at 6 in the morning,
Yeah,
and just sort of stick to your guns.
I don't know. I just think okay to wake clocks are fun.
That's
Oh,
because
look,
you
it's-
invented the okay to wake clock.
I did not invent the okay to
Wish
wake
you
clock.
invented it.
I
Okay to
do.
wake clock. If you want to sponsor us,
You
put our
know?
email at the bottom of the show.
I mean, I did work for Hatch a long time ago, so
Yeah. No, it's great stuff. Okay, Dr. Ula, believe it's a pediatrician, asks, my 19-month-old used to sleep through the night, but has recently started waking up multiple times and crying for reassurance. He won't go back to sleep unless we hold his hand through the crib bars. It's very touching image. What can
sure
we
it's-
do to help him sleep through the night again?
I'm sure it's not touching in the middle of the night. It's exhausting. I mean, if the child used to sleep well previously, I would think, well, how did you go about teaching your child to sleep independently initially? And then sometimes you just have to go back to basics. I would also say look at daytime sleep. I don't know if they've transitioned to one nap at this point. I would assume so, but sometimes children hold on to 2 naps for a while. It's time to transition to 1 nap. I also say that that's like a very common age for language development, and there just happens to be a lot of nighttime awakenings when language is exploding. So it's so tricky because it sounds it's like, well, if you don't want that to happen, then stop doing it. But it's so hard as parents to just stop doing something if you feel like your child needs you. So
And we don't know the time frame of this. Maybe when I sent this email out to my email list, it happened for a night or two. Maybe it's been going on for a week or two. Certainly, if something's happening for a couple of nights, I'm not that worried about it. But if it's becoming the new norm, that's when it's a problem. I think that looking at the naps is definitely a money. If there's 2 naps, I'd go to 1. Make sure there's not something medical going on. And think if there's anything that changed in your routine or your child's life that might be a factor here.
all of that.
Okay, so here, sleep disorders and medical concerns. This is one probably for me, though it's not a disorder I treat. Sarah asks if it's possible for someone with REM sleep behavior disorder to perform complex movements like getting out of bed and opening a door. My father-in-law, who has all the risk factors for REM sleep behavior disorder, was hurt in the early morning after supposedly waking up. Could he still have been asleep? In short, the answer is yes. REM behavior disorder is where someone loses atonia, which is the suppression of muscle activity, except during REM sleep, your diaphragm and your eyes muscles can move. Everything else is paralyzed. And that is specifically to keep you from acting out your dreams. So patients with REM behavior disorder can act out their dreams, and the dreams often have violent content. So that is a possibility. Another possibility is he just could have been sleepwalking. Even a sleepwalker, and sleepwalking is a non-REM parasomnia. They can get out of bed, open a door, leave the house, turn on the oven, etc.
Well,
Certainly, I'd say one episode, weird things happen sometimes, but if this is a pattern, I definitely think he should be evaluated by an adult sleep specialist if he is wandering the house in his sleep. There are forms of nocturnal epilepsy that can look a little bit like this too, though that would be less common. So yeah, that's an
that's
interesting
scary.
one. It is scary. People are interested. Mike Birbiglia is a comedian, has a special called Sleepwalk with Me. He was diagnosed with this disorder, and actually, because of a dream, he jumped out of the window of his
What?
hotel.
Oh,
Fortunately,
God.
he was on the second floor. So he was just pretty banged up and had to walk in the front entrance of the hotel in his underpants and
Oh,
ask
my
the
gosh.
nearest hospital.
Oh, Lord.
So, yeah. Here's another one. Wenjing asks, my 7-month-old has been diagnosed with silent reflux, so we had to hold him upright to sleep. Now that we're trying to transition him to the crib, he won't fall asleep unless we hold him. Should we just keep trying, or are there more tips you can offer to help him sleep independently? It's a tough situation.
Very tough. I've worked with many really intense reflux situations. And one of the biggest issues is that, sleep training, usually there's some crying in the beginning, and crying often results in more saliva, and that saliva can, cause reflux to flare up a bit. So it can be challenging to work with families like this. I would definitely get clearance from the GI doctor. I'm assuming that you have one because you have that diagnosis. But then I would consider what feels right for you for a sleep training method. And perhaps it's a more hands-on method and slowly removing yourself from the situation. You may have to, literally have your hands on him for a little bit, or you do some sort of a check-in method where you go in and you lay hands on him. But I mean, unfortunately, the only way through it is through it. And it can be done even with children who have reflux, or, GERD. But again, I would definitely speak with the pediatrician or the specialist before moving forward with anything that may include some sort of crying.
Yeah, it sounds like they've been receiving medical care in the line. I mean, I would ask yourself too, if this also feels like the right time for you to do it. I'm assuming it is, that you're tired of dealing with the nighttime awakenings. I think you just have to go really gradually, and maybe you lay down next to the baby and you hold him for a little bit. Maybe you're just patting him to sleep and you're really gradually ratcheting back your involvement. But best of luck. Again, this is not going to last forever, but it probably will be a little bit of a rocky transition.
Yeah.
Okay. Now, last question from Amelia Juan and baby Tonio, and they sent a picture of the baby. Ariel, I'm going to send it to you. It's very cute.
Yes.
We followed the CIO sleep training method with our 6-month-old, but even at 9 months, he still cries himself to sleep every night, though briefly. How can we help him stop crying in bed?
And you might have a different answer, but for me, some babies just do that. And
Agreed.
it's like a normal way for them to decompress, and they get it out in 5 minutes and then they're asleep. And sometimes it's even for naps. And I just find that it's pretty common, not even say common, but it's normal, and nothing of concern, and that he will eventually grow out of it.
I would compliment you guys on successfully sleep training your child
Yes.
and also staying the course, even though he is crying slightly every night. I remember one of our friends' kids did this for a year, and he is now a junior in high school. He's doing great. Your baby Tonio is going to be fine.
Yeah, and that's actually something I've been hearing a lot from other consultants that I speak with is that exact issue. I think sometimes we get this impression, and perhaps I blame social media for everything, but I liked that and smart technology.
We didn't have social media.
Yeah,
And it was great.
smart technology and social media are I have a beef with both of those things. But I just think that there's this unrealistic picture that when you sleep train, your baby and your child is never gonna hit any bumps in the road. They're never gonna cry again in their sleep. They're never gonna cry to fall asleep. It's they're not robots, and staying consistent is key. If you're ever worried about your child for whatever reason, go to the doctor. Crying a little bit at the start of the night is it's pretty common.
Yeah, it's common. It's not cause for concern. You're doing a great job.
Yes. Oh, that's another big important piece. You are doing nothing wrong.
Yeah. Feel good about where you're at. So that's our questions for this week. Ariel, what's our email address? I can never remember.
thesleepeditshow@gmail.com.
Okay. Or go ahead.
I'd love to hear from, was it Hunter? I'd love to hear from Hunter, the 6 and 4-year-olds, the waking at 4 a.m. or whatever. So if you could email, that would be great.
That seemed to be a little bit out of range. I'll send him an email back as well. So, thanks for your attention. Hope everybody gets some good sleep, especially as we're heading into daylight savings time, or the end of daylight savings time, I should say.
That's right.
So hopefully this will come out before that happens.
Yes.
We'll see. I got a busy couple of weeks. Okay, good.